Good morning and welcome to another edition of Health Connection Radio. I'm your host, Jay Foster. We are here with you on the internet radio station, route664.org. You'll find other shows and various different topics. Les Haber has a jazz show. Les Winston has The Road to Human Kindness about charitable contributions. Lots of information at route664.org, and you can download the app by going to route664.org. Our show airs Monday mornings at 9 a.m. and a rebroadcast at 6 p.m. on Mondays. More information on our programs at Body Chemistry Associates, our 42nd year in South Florida doing work in human nutritional biochemistry and applied clinical nutrition. You can reach us by email, bodychemistryassociates@gmail.com, or call our office at 305-670-6702. Toll free is 1-800-CHEMIST, 1-800-243-6478. And our website's down right now. We're looking to rebuild it and change it, but you can call those numbers or send us an email. And if you'd like a copy of this show as a podcast, just request that and we'll be happy to send it to you. 1-800-CHEMIST, 1-800-243-6478, local number 305-670-6702. Well, during Heart Month, I wanted to give you some information about two very important tests that your doctor or cardiologist even probably doesn't do. And that's homocysteine and oxidized LDL. Let's start with homocysteine. If you have elevated levels of homocysteine, those are associated with an elevated risk of heart disease, stroke, Alzheimer's disease, Parkinson's disease, certain cancers, osteoporosis, depression, and things we haven't figured out yet, but especially a high incidence of heart attack and stroke. Now, I interviewed the guy who did a lot of research on this, Dr. Kilmer McCulley, MD, and he wrote a book called The Homocysteine Revolution. I interviewed him on my radio show quite a few years ago. I was on the radio down here in South Florida for 20 years, daily. And Dr. McCulley, Kilmer McCulley, was kicked out of Harvard because they wanted him to study cholesterol, and he said, no, this is really, really important. And they kicked him out. Later, they had him back because they realized how important homocysteine is, or was at that time, and it still is. This is on homocysteine in your heart. Serum homocysteine, that's in the blood. Long-term risk of myocardial infarction, that's heart attack, and sudden death in patients with coronary heart disease. This is written up in the journal called Cardiology in 2007. That's not a lightweight journal. Results showed that elevated homocysteine levels were associated with a 2.5 times, that's 250% higher risk of subsequent coronary events, which isn't a good thing. So 250% higher risk just by having a high homocysteine. Now, we like homocysteine less than 8. The labs sometimes say less than 11. We like it, and several researchers that I'm familiar with like it below 8. So that's what we look for in our center at Body Chemistry Associates. Now, one reason I believe that your doctor or cardiologist doesn't think much about homocysteine is that it doesn't sell any drugs. There are no drugs to fix it. The only way you fix a high homocysteine is with high-dose folic acid and some B12 and maybe B6. The B vitamins and folic acid really bring it down. Now, this paper was in the International Journal of Cardiology way back in 2007. This is not brand new stuff. We've been looking at this for a long time. Influence of high homocysteine and low folate levels, folic acid levels in the plasma, in the blood, in medium-term prognosis after acute coronary syndrome. International Journal of Cardiology in 2007. And the quote is, Low folic acid levels, were associated with more than an 800% increased risk of cardiovascular mortality, that's death, while high homocysteine levels were associated with more than a 200% increased risk for major cardiovascular events. Thus, the authors of the study conclude low folic acid levels and moderate hyperhomocystinemia, that's slightly high, were identified as independent predictors of cardiovascular events in follow-up studies. Now, doesn't that sound like something that your doctor or cardiologist certainly should be paying attention to? But they're not, because it doesn't sell drugs, so they're not taught about this. It's just folic acid and B12. Now, we have a formula that's excellent to bring down high levels of homocysteine. It works almost every time. And once we see test results to find the homocysteine is high, then we add this formula in and check it in a month or two, and it almost always brings it down to normal. So you can call us at 305-670-6702, Body Chemistry Associates, or 1-800-CHEMIST for more information on that. So not only are we suggesting that this is a risk factor for heart attack and stroke and some of the other conditions I mentioned, but it's also something that we can control nutritionally. Don't even need medications to bring this down. It comes down nutritionally, and that's part of the problem because it's pretty cheap to test for it and to fix the underlying problem. So that's homocysteine. Every doctor should do it once, should be taught about it first of all, so they know what it is, how significant it is, and what to do to fix it, because it works. The fix works almost every single time. Now, so that's homocysteine, and that's very important. Now, the other one that we've been doing recently, there's a lot of research on it, is oxidized LDL. LDL is the bad cholesterol, LDL. Now, what the research shows is it's not just the LDL that's bad, but it's especially when it becomes oxidized. It turns into a free radical, and regular LDL kind of just bumps around and doesn't do much, but oxidized LDL does. This is a study out of a Japanese medical journal back in, I guess I didn't copy this, how long ago this was, but I got other ones. Low-density lipoprotein cholesterol is important for cellular function, but in high concentrations, it can lead to atheroma formation, hardening the arteries, atherosclerosis. Over the past several decades, it's become abundantly evident that the oxidized form of LDL cholesterol is more important in the progression of atherosclerosis than regular old native unmodified LDL. Oxidized LDL leads to endothelial dysfunction, an initial step in the formation of atherosclerotic plaque. Oxidized LDL binds to a number of receptors and can cause a lot of problems, including that LOX enzyme, lipoxygenase, which causes inflammation. So oxidative stress, oxidized LDL in the development of atherosclerotic plaques. Another one. This is back in 1996. Again, we've been looking at this for quite some time. This is out of the Journal of Nutrition in 1996, April of 1996. The role of oxidized LDL in atherogenesis, the development of plaque. An elevated level of LDL constitutes a major risk factor for atherosclerotic disease. Although the precise mechanism in which LDL promotes this atherosclerosis, remains to be elucidated, the oxidative modification of LDL may be a crucial mechanism. Several lines of evidence support a role for oxidatively modified LDL, oxidized LDL, in the development of plaque. LDL can be oxidatively modified in using a lot of different experimental models. Oxidatively modified LDL is taken up by macrophages and can cause foam cell production and a risk factor for heart disease. Now we go back to 1992. The role of oxidized LDL in the pathogenesis, the development of atherosclerosis. This is out of the Annual Reviews of Medicine. Again, these are not lightweight medical journals. These are solid, peer-reviewed medical journals out of PubMed. 1992. The role of oxidized LDL in the pathogenesis of atherosclerosis. High cholesterol, hypercholesterolemia, is a major risk factor for the development of plaque. Recent evidence suggests, this is 1992, that oxidative modification of the major cholesterol-carrying lipoprotein, the LDL, renders it more atherogenic. It is much more likely to cause atherosclerosis. Not only does oxidized LDL have enhanced uptake by the macrophages, which causes foam cell production, but it also tears apart the arteries. So this is what they're worried about with LDL. Now, what are they told to do with LDL? Are they told to, I'm talking about medical doctors, are they told to, use antioxidants or look for oxidized LDL? No, they're told to just give Lipitor or another statin drug to bring it down. Now, if it's oxidized, so what we do is if we see an elevated LDL, we run another test that's for oxidized LDL. And Quest does a nice job of giving a little graph, and it says it should be below 60. We want it as low as possible for oxidized LDL. And I particularly believe that oxidized LDL, if you're oxidizing your lipids, you're probably oxidizing your catecholamines in the brain, which may lead to Parkinson's and Alzheimer's disease. But I digress. Oxidized LDL can be brought down with extra antioxidants. And depending on what the person is taking and what their numbers are, then we give 1 or 2 different antioxidants, retest it in, let's just say, 2 months, and see if we've not brought it down to normal. In almost every case, we can bring it down with antioxidants. Vitamin E, vitamin C, CoQ10, resveratrol. Several different antioxidants work very well. We've got a formula called 1,000 Glasses of Red Wine, or resveratrol, that works very well in addition to these other antioxidants. So the bottom line is your doctor should be ordering these, but they're not. Both homocysteine, in addition to a regular lipid profile and a regular blood chemistry, homocysteine and oxidized LDL. You can ask your doctor for these. They may say, no, you don't need that. And if they say that, you can come see us. We do it on a regular basis, and we do before and after. If it's elevated, we do one afterwards after we do natural therapies, vitamins and minerals and dietary changes, and we almost always see good results, both with homocysteine, with total cholesterol, with oxidized LDL. And by the way, if you've been put on a statin drug and they didn't put you also on CoQ10, that should be malpractice, because statin drugs deplete CoQ10, which can lead to congestive heart failure and a number of other conditions, and memory loss, quite a few different conditions. So we're not saying don't take a statin, but if you do take it, make sure you take copious quantities of a good form of CoQ10. We have one Q-gel that works really, really well. More information on our programs of Body Chemistry Associates. This is our 42nd year in South Florida. We do testing for anyone in Florida, the whole state. 1-800-CHEMIST, 1-800-243-6478, the local number 305-670-6702. Well, this has been Jay Foster on Health Connection Radio saying thanks for tuning in today. Enjoy the rest of this beautiful day. We'll be with you again on our next show.